Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, April 21st. I'd like to remind our listeners before we begin that this COVID-19 update will look slightly different than the ones you've seen in the past. Dr. Hanley will provide case updates and will focus on technical aspects of COVID. Sign language interpretation is being provided by Mary Thiessen and French language translation by André Boursier. The Q&A format for media will remain the same. We will call reporters by name and each will have 2 questions. Before we begin with our speaker, I would like to verify that everyone can hear. If any of the reporters are having an issue, please email ecoinfo@yukon.ca. Dr. Hanley?
Thank you, Pat. Good morning. Bonjour. This morning I'd like to give some perspective on the COVID activity in Canada and how that relates to our situation and to the weeks ahead of us. From the very start of this pandemic, I've committed to keeping Yukoners as informed as possible. As always, it can be challenging to interpret information that changes so quickly. When we've been in this for so long, and when people are tired, it can feel that things are out of control. But we're fortunate that within Yukon, we remain well positioned, and the pandemic is still well within our control. A third wave of COVID-19 fueled by variants is pounding the world right now, and Canada is no exception. In Ontario, Quebec, Alberta and BC in particular, the pandemic's toll is heavy, with increasing case counts, hospitalizations, and ICU admissions. This wave has returned some of these places to even tighter restrictions than before, and in some cases, new measures have been introduced to keep the spread of COVID-19 moving between jurisdictions. These steps are harsh, and we all have family members or friends or know people living under these difficult conditions. Unfortunately, those measures are necessary to wrestle control of the pandemic back from the brink. It is hard to predict the next few weeks, but waves do come to an end, and vaccine uptake is really starting to take off in the rest of Canada. And that is good news for us. Whatever happens, I will be here with you as we ride out this wave and look forward to calmer times. At present, we remain with just 2 active cases who are themselves close to recovery. Our newest case has already reached the recovery period. Many Yukoners are getting ready to welcome home their university or post-secondary students for the summer, and I'm sure the students will be glad to get back to Yukon, where life is less restrictive than in many other places. We will also see seasonal workers arriving. First of all, a reminder that returning students and seasonal workers will be required, as everyone, to self-isolate for 14 days. Due to several requests from students and employers, we have worked out a way that these returning Yukoners can get vaccinated while in isolation. Returning students and seasonal workers will be able to leave home isolation for a short period of time to take advantage of the vaccination clinic. Before receiving this vaccine, they will have to make an appointment at the COVID Testing and Assessment Center, where they will be given a rapid test. If negative, they will be sent to the immunization clinic for their shot. Strict protocols will be in place for this cohort, and only those with the same-day negative test will be able to receive the vaccine. Students and seasonal workers must return to quarantine after receiving their shot to finish out their time. This is certainly not a get out of self-isolation early card. Getting the vaccine while in isolation will only be available to this group until the end of May. More details will be available on yukon.ca by no later than end of day tomorrow. Getting students and seasonal workers immunized before they leave isolation gives them a leg up when they return to life outside the isolation bubble, and we can certainly encourage all to take advantage of this opportunity. I see this as a win-win deal. For them, it's an advantage to get vaccine early and be that much safer when they interact with their friends and with the public after the self-isolation period. For us, it's an additional incentive for more people to get the vaccine. Unlike our partners across the country, we are much further along in our vaccine campaign, but we still have a way to go. The evidence is clear that vaccines are working and are successfully providing protection from severe illness and death for many. As of the end of the day yesterday, we had vaccinated a total of 25,216 people with their first shot, and 20,775 are now fully vaccinated. I continue to be encouraged by the number of individuals who have stepped forward and rolled up their sleeve, and it's been with great pride that I have seen this happen. We're continuing to increase our numbers week by week, and this is fantastic. If I give the current numbers by percentage of eligible adults as of April 20th, in the 18 to 29, we now have first dose uptake of 56%, and in the 30 to 39 age group, 67%, 40 to 49, 71%, 50 to 59, 73%, 60 to 69, 81%, 70 plus now up to 89%, and overall eligible adult percentage 71%. So Yukoners, please keep up the progress and please do the right thing and continue to come forward for that first dose. By the way, second dose overall coverage is now at 59%. For those holding back, make sure you reach out and ask if you have questions about whether the vaccine is right for you. If we can continue to get our younger people up to the same levels as our older citizens, we will be well positioned to have a great summer where we can ease up on many of our current restrictions. There will be more to come on what that could look like in the weeks to come. But immunization is our best way to find our way out of this pandemic and to stave off the threat of variants. Immunization will keep us on the path forward. There's one other group that we have mentioned for vaccination, but perhaps not enough, and this is for people who are pregnant or breastfeeding. I would like women who are pregnant to strongly consider vaccination if they haven't already. We have acknowledged in our information that pregnant and breastfeeding women were not specifically included in the Moderna clinical trials, and that's normal. However, we have a long history of using inactivated vaccines in pregnant women with a solid safety record. There is no reason to suspect that there would be any particular risks to mother or baby from vaccine, and real-world evidence is proving that true. On the other hand, we have increasing evidence from people affected with COVID disease that pregnant women can get seriously ill with infection. I would therefore strongly encourage anyone in either of these two groups to have a conversation with their family physician or community nurse and consider strongly coming forward for vaccination. As we continue towards vaccinating as many people as possible, please have that conversation and seriously consider protecting yourselves from COVID-19. As I mentioned last week, our biggest risk of seeing COVID-19 in the territory is through importation of cases, particularly variants related to out-of-territory travel. As we see variants continue to ascend to dominating over previous strains, I want to ensure that we take a proactive approach and mitigate our risk as much as possible so that we can continue to safely ease other restrictions within Yukon. To that end, I want to add to what I said last week about strongly recommending that Yukoners change how they self-isolate. Over the Christmas season, we had two options for self-isolation for those who traveled into Yukon to celebrate the season. We're modifying those options now that variants have changed the picture and the risk. Both on the national scene and locally, we have seen how variants can rapidly spread despite the best intentions. It is quickly becoming apparent that variants transmit much more easily within households, despite carrying out existing physical distancing requirements. And as a reminder, with last month's release of the Path Forward plan, we landed on 2 basic steps to moving ahead. Step 1, strengthening the overall foundation. And step 2, with that strengthened foundation, beginning to ease certain restrictions. Strengthening certain measures to protect against importation is thus a crucial step in how we move forward. From now on, if you are returning from travel, I'm strongly recommending one of the 2 options for self-isolation. Option 1, if you're traveling alone or with other people, you can self-isolate alone or with your travel companions only. This means you must self-isolate separate from your receiving hosts. Separately. You can stay in a legal suite, a vacation home, or an Airbnb or a hotel somewhere apart from the ones from the receiving hosts. If you're planning to self-isolate upon arrival with your hosts or family in a shared household setting, then everyone in the household needs to self-isolate together and to follow the rules of self-isolation. We know it is hard to keep apart unless completely separated. And with the spread of variants, we need to be extra cautious. Everyone should isolate for 14 days. Keep in mind this self-isolation period starts from the day the visitor arrives in the household. Again, I strongly encourage you to follow these recommendations to keep both visitors and guests safe. And to support these 2 options, we will be increasing follow-ups to check on those who are self-isolating and provide guidance and support. As we have seen variants become dominant in so many places, I want to ensure we're on a track to return to a place of normality and restoration. We are at a point in this pandemic that we can start to think about easing certain measures, but in order to do so, we have to strengthen the areas where we are more vulnerable. And right now, our weakest point remains travel out of territory and importation risk. I do want to add one important detail to the above recommendation. When household members are fully vaccinated, the risk of transmission within that household is much less. Therefore, I am quite comfortable with returning students or visitors staying in the same household as fully vaccinated adults, as long as all the usual requirements of self-isolation are still adhered to. Please note, at this point, the laws around self-isolation have not changed. The new approach is my strong recommendation, but is not a change in CIMA orders. Self-isolation continues to be an integral part in our layers of protection. As we have seen in the past weeks since our first announcements of variants, it has been a key tool in containing and maintaining low case activity within Yukon. There's another item I want to touch on briefly, and I think another positive story. At this time, I'm pleased to report that the government has accepted recommendations around lifting some restrictions within long-term care. As you know, long-term care homes in Yukon were locked down very early in the pandemic, and these measures have kept our residents safe over the past 16 months. Long-term care homes will be engaging with residents and families to work towards community outings being safely supported and planned, and an increase in the number of social visitors for residents. And the goal is to implement these changes by the week of May 3rd. Finally, another reminder about the Safe 6+1. Sometimes these steps are easy to gloss over, but these measures remain an essential way that we have been able to stay largely COVID-free. So let's repeat these once again. Number 1, maintain physical distancing of 2 meters or 6 feet with people outside your social bubble. Number 2, wash your hands often. Number 3, stay home and away from others when you're sick, and get tested if you have symptoms. Number 4, follow gathering rules, whether indoors or outdoors. Number 5, follow travel guidelines wherever you are. Limited, respectful travel is still the prevailing direction. Number 6, self-isolate when you are required to for either travel or public health reasons. And number 7, or our +1, is wear a mask when in indoor public places. That is the law. And remember, as written in a law, and I will quote from the order, mask means a medical or non-medical mask, and for greater certainty does not include a balaclava, bandana, face shield, hijab, neck gaiter, niqab, scarf, or other similar face covering. So that's it for today. I hope everyone continues to stay well and take care of each other. Thank you. Merci.
Thank you, Dr. Hanley. We'll move to the phone lines now and begin with Philippe, CBC Yukon.
Yes, thank you. I want to ask about a social media post made by Catherine Smart, Dr. Catherine Smart, president of the CNA. On April 19th, she said, "Today in Yukon, our government asked who would be willing to deploy to Ontario." I wonder if, Dr. Hanley, you could tell us your thoughts about deploying resources from Yukon to other parts of Canada.
Thanks, Philippe. You know, if nothing else goes out from Yukon, our hearts go out to Ontario and to the many people who are suffering the strain, whether as patients or as the incredible healthcare providers who are doing everything they can to help and to do what they've dedicated their lives to doing. So it is a very very difficult situation. But similarly, it's also difficult for us when we are, I would say, overall stretched to provide the ongoing care that we need to provide. And so I think there's the way that we have that we run our system, whether we're looking at, in general, the hospital, the healthcare facilities, the community nursing, it's pretty tight, and people I know are stretched in efforts to carry out the normal healthcare demand. So even while the direct toll from COVID, of course, as a burden on healthcare is very small in our territory, the healthcare delivery during COVID times is particularly challenging and particularly stretching to a territory that already is stretched in capacity. And if you look at, for instance, our medical specialists, they are a small cadre of skilled specialists that it would be very difficult to part with one or more at a time. So I think I really appreciate that Dr. Smart put the message out, as did the president of the Yukon Medical Association, to certainly just looking, if anyone can do it, then but by all means I would support that. I know on the nursing side, I don't think there is enough capacity, unfortunately, to send anyone to Ontario. So it's really a matter of, you know, what unfortunately these tiny jurisdictions have little practical to offer to large jurisdictions from Ontario. But having said that, the call has gone out, and perhaps there will be some individuals who would be ready to go and help.
Thank you. Philippe, do you have a second question?
Yes, thank you. In the Northwest Territories, residents who've had both vaccines will only need to quarantine for 8 days. Then, if they have a negative COVID test on day 8, I believe they're free to go. Could you contrast your thoughts on that policy?
Yeah, thank you. That's a new announcement that came today from NWT, and I'm really happy to start to see that these alternatives are being implemented where they can be. And I can tell you again that we are still officially in caretaker mode. We are working on some recommendations for options around alternatives to the current regime of the standard 2-week quarantine for all. So there are a number of possible variations. We're looking at the risks and benefits of each of these, especially in the face of the variant surge. So again, this is a time where Everything has to be reconsidered in terms of importation risk and variant spread and the impact. But at the same time, we know that we are starting to near the vaccine levels that we've all wanted to see. So I think while we're analyzing and working on some options to present to the new government, the more we can do to get our numbers up, the more I think comfort we'll be able to have to consider alternate options.
Thank you. We'll move to Luke, CKRW.
Hi, Dr. Hanley. I'm curious as to if you have certain recommendations around how long these students or seasonal workers should be in their self-isolation prior to temporarily leaving to go get tested and vaccinated.
Yeah, the actual time, I'm not actually very worried about how long they need to stay in self-isolation. I'm more concerned that the plan and the protocols are worked out. So there will be actually quite detailed guidance produced for students to maintain that protection, and that includes, you know, how to get there safely, how to get tested, waiting for the test result, special time slots at the immunization clinic to prevent any possibility of exposure risk at the clinic itself. So really, I'm quite happy whether that occurs on day 0 or day 10. It's more a matter of the following the protocols that are set up.
Thank you. Luke, do you have another question?
Yes, I was just curious if there was a variant strain identified with the most recent case that came along with the exposure notification in Watson Lake.
No, thanks for asking that. No, I don't have that information yet on variant screen. So in general, when we've heard fairly soon. But regardless, I mean, it actually won't make any difference to this particular case or the management of this case. And just is maybe a good reminder that we treat, because we don't have that information generally when we get the results, we treat all incoming new cases as variants. We assume they're variants until we prove otherwise. So in this case, the point is moot, but we don't have that information as yet.
Thank you. We'll now move to Tim, Whitehorse Star.
Yes, good morning. So my first question is, I recently saw a story from another media source that one of the top doctors in Whitehorse is concerned that we've hit a plateau in vaccinations. Would you agree with that summation, and what could be done?
Yeah, thank you. So you're referring to Dr. Ryan Warshawski, the president of the YMA, who spoke yesterday about his concerns about the slowing down of young people getting vaccinated. Of course, we did talk with each other. We connect with each other regularly, and so I shared with him some of what I was seeing. So that, yeah, technically, what we have seen, and which I've expressed many times here, is we saw a very rapid initial uptake amongst all age groups, and then a kind of a slowing down. So we're definitely in that flatter part of the slope. So we need to continue to work with our younger people in particular to make sure that they are aware of all the opportunities they have to get vaccinated, and that we address any of those lingering concerns and hesitancy. So an example is, like I said, focusing on pregnant women and making sure that they feel confident about coming forth for vaccine. Another is the example of students and incentivizing newly arriving students to come forward, and perhaps spreading the word about the importance of getting vaccine, particularly many of these students coming from high prevalence areas. So I think all of these pieces are helping, and we have to acknowledge at the same time that we are seeing an increase. Even though it's slowed down, the slope is still going up. So as as not that long ago, but towards the end of March 22nd, we saw 47% uptake in the 18 to 29, and now we're seeing almost 10% higher uptake at 56%. So it's moving up, and that's great. And I think we just need to keep that upward movement going.
Thank you. Next question, Tim?
Yes, thank you. I'll change gears a little bit. With it becoming more and more obvious that it's the spreading of aerosols and through the actual air we're breathing that's spreading the virus, what is the latest advice, or should we be looking into improving ventilation systems considerably? What would work and what wouldn't? Is there any uniform advice available on that?
Yeah, I think there is, and I think there has been increasing recognition over the past months of the role that aerosol transmission can play. And I think the way that I would think about this most practically is it's coming back to those Japanese 3 Cs that Japan promoted and that we also adopted in Canada and elsewhere. And it's about closed spaces and crowded places and close encounters, close distance. So those are the factors that lead to the increased risk of transmission. And some have added to that considerations around ventilation and air circulation. So well-ventilated places are definitely part of the prevention of COVID. So if there is a chance to look at and improve ventilation, particularly in older indoor areas, then definitely take those opportunities. It doesn't necessarily mean that everyone has to revamp their existing ventilation. I think it's just being aware that poor ventilation is a risk factor in addition to those other circumstances. So if you start to put those C's together, you have many people in a poorly ventilated indoor space where there's crowding and not ability to distance, then you are definitely in a high-risk setting for transmission of COVID should anyone in that room be infected. So I think it's just being aware of those circumstances and mitigating those. Fortunately, at this time, we are in an opportunity where we can be opening windows and bringing in outside air. We know that outdoors is probably 99% safer than indoors, just because now you have the advantage of highly reducing aerosol transmission by the sheer fact of being in the well-ventilated outdoors. So the more we can emulate that, I think, the better.
Thank you. We'll move to Nick, Canadian Press.
Hi, thanks for taking my question. I'm curious if you're able to talk a little bit about the concern of students and seasonal workers and the potential to spread COVID-19 when they come to the territory. Thanks.
Again, our tool has always been and remains for the time being self-isolation. So the key to preventing a spread of COVID in territory is that 2 week of self-isolation, so that if people come in with infection, then there's that incubation time that's allowed to identify if that infection has occurred, and the isolation as well as the identification of the case mitigates that threat or risk for transmission. So that that remains our key tool. I think that when it comes to students coming back, as I said, many are coming back from high prevalence areas, but many have been planning to come back for some time, so they know what the risks are, and I think that most of them will be doing their best to avoid high exposure locations in the time that they're preparing to come home. And if they're not, then they should be. And on the flip side, we have that self-isolation period to protect, protect against that possibility. What I look forward to is that when students are finished their self-isolation, they're going to be taking on jobs, they're going to be meeting friends, and so the earlier I think that we can provide them those opportunities to be vaccinated and to kind of spread the word of infection, of vaccination, the better set up they will be to prevent the spread of infection.
Thank you. Do you have another question, Nick?
No, that's it from me.
Thank you. We'll move to Claudiane, Radio-Canada.
Oui, bonjour. Donc, en français, c'est possible de me parler, Dr. Hanley, de ce ralentissement de la vaccination qu'on observe actuellement, donc mentionné par le président là, de l'association médicale. Comment est-ce que vous expliquez ce ralentissement et est-ce que vous êtes inquiet? Quelles seraient les répercussions possibles de ça?
So could you please go back in French on the slowdown of the uptake of the vaccine, and if you're worried about this, and what can be done to remediate to this?
Et merci Claudienne pour la question. Oui, c'est vrai qu'on a témoigné un ralentissement de vaccination surtout chez les jeunes, mais en même temps, je suis encouragé pour voir les chiffres semaine après semaine qui sont quand même en train de monter. Donc, on a changé juste dans moins d'un mois. Il y a 4 semaines, le chiffre était à 47% chez les jeunes moins de 30 ans. Et maintenant, c'est à 56%. Donc, ça montait presque à 10% dans 4 semaines. Donc, on est quand même encouragé par la réponse. Les jeunes ont souvent des raisons différentes, évidemment, pour être un peu plus à l'aise pour venir, pour accepter la vaccination. C'est que souvent, ils ont besoin de plus d'informations ou ils ont plus de temps pour décider. Pour prendre une décision. Mais aussi, souvent, ils ont une perception de risque qui est différente. Et c'est vrai que ils sont moins à risque que les plus âgés. Donc, c'est pratique, surtout dans un environnement comme le nôtre où on a une bonne activité de COVID. C'est normal que la perception de risque, c'est vu comme moins sérieux chez les jeunes que chez les plus âgés. Donc, je pense que c'est une combinaison de facteurs. Mais aussi, je pense, plus et plus, les jeunes se rendent compte que les opportunités sont plus sont plus grandes pour ceux qui sont vaccinés. Donc, le plus qu'on est vacciné, le plus on peut faire comme une population. Donc, je pense que c'est pour ça qu'on voit plus et plus qui viennent pour la vaccination. Et je pense que c'est aussi l'influence de la variante, de voir la situation dans le sud, dans beaucoup de provinces, ses collègues dans les provinces qui sont touchés beaucoup plus par la variante qu'avant. Donc, je vois que la perception de risque, ça change aussi avec le temps. Donc, je suis encouragé mais on continue de travailler avec les communautés, avec les groupes, avec les jeunes pour bien comprendre les raisons et pour répondre aux raisons.
Merci. Claudiane, avez-vous une autre question?
Oui, donc juste pour poursuivre là-dessus, donc les conséquences de ça? Est-ce que c'est-à-dire que l'hésitation de se faire vacciner pourrait retarder l'assouplissement des mesures? Est-ce qu'on peut dire ça?
So to continue on the same question, what are the consequences of this slowdown? Could it be possible that it would delay the lifting of some of the restrictions that we have right now concerning the pandemic?
C'est possible, oui, mais ça dépend d'autres raisons aussi. Le cible idéal, c'est qu'on a un taux plus ou moins le même pour chaque niveau de l'âge. Donc, que si on peut atteindre le plus haut possible, et comme ça, je veux dire idéalement 75% chez tous les adultes, on sera beaucoup plus confiant de poursuivre l'enlèvement, les recommandations pour l'enlèvement de mesures dans certaines areas. Et donc, c'est ça le travail qu'on fait maintenant, c'est de voir toutes les possibilités, de voir qu'est-ce qui arrive autour du monde, qu'est-ce qui sont sur la table pour enlever, qu'est-ce qu'on peut compter comme évidence et comme on voit l'expérience d'autres pays ou d'autres juridictions. Donc, c'est sûr que le plus qu'on est vacciné, le plus confiante on peut être pour poursuivre les possibilités d'enlever les mesures.
Thank you. We'll move now to Haley, Yukon News.
Thank you. I was looking for a little more detail, if it can be provided, about the case in Watson Lake. Was that a situation where a person left self-isolation early?
Yeah, I don't want to, again, get too much into details which might disclose individual case information. But and as always, I think it's important to keep in mind that our notifications are taken with the fullest precautionary approach. But there was a situation where I would say self-isolation was not carried out to the letter, even though overall the compliance with self-isolation was almost complete. So an individual who went to many measures to ensure compliance with self-isolation. So I think it just shows again to the possibility of, even with a small breach, as it were, a small lapse, that there can be a potential for transmission even when protocols are followed. And so it's with that measure of caution and in recognition of the possibility of variants that we post these exposure notices.
Thank you. Haley, do you have a second question?
Thank you. Yes. My other question is around the new guidelines for self-isolation, because they are just guidelines, as you noted, and not new CIMA requirements. I'm wondering if you have advice to people who may be in situations where they're in a shared living situation and don't necessarily have control over who their roommates are or what they do if they're traveling back from the territory, and an individual would prefer to not be living with folks who are self-isolating, but may not necessarily have that choice, if that makes sense. Would you have any advice for those people?
Yeah, thanks. I think that's a really important question. And the first is that although this isn't a change in CIMA orders, the orders are around the need to self-isolate and to follow the guidance on what that actually means. And so the orders are that needs to be followed to the letter. And so people need to be aware of what the orders actually say and what self-isolation actually means. But recognizing that there are circumstances where that is going to be more difficult just because of the reality of living. An example would be adults not from the same family living in a shared household. And if it cannot be carried out that there can be completely separate quarters, then I think a call for support, a call to COVID info, consideration of the SIF, for example, of the self-isolation facility, or of alternatives. And so I think the options then can be reviewed with that person or people so that they're aware of what the other options are and with potential supports that could be available through self-isolation facilities when it's just not possible to comply. The other thing which I think is relevant in this is recognizing how useful and important it is to be vaccinated. So if there are, when we think again of where have we seen transmission, and where do we see transmission when we look around the country, workplaces are a common place. And shared households are another common place, and so making sure what can be done to prevent that. An obvious thing is vaccination. So making sure that members of a shared household, the adult members who are eligible, if they were all vaccinated, again, that dramatically will decrease the risk of any issues associated with transmission of COVID in the household. So that's also a preventative aspect I would be strongly encouraging now.
Thank you. I'd like to thank everyone for their time today and advise that the next COVID-19 update will take place on Wednesday, April 28th at 10:30 a.m.